Welcome to Holistic Medicine, Problems and Prescriptions for Our Ailing Healthcare System, a presentation of the Civitas Institute. To cure our healthcare system, we have to look at things holistically. Just one or two reforms will have a small effect. We need comprehensive reform. First, we must identify the pathologies. Then we must offer prescriptions. But most reform efforts get this the wrong way around. In other words, many would like to treat the symptoms, but ignore the underlying problems. The United States has never really had a healthy, well-functioning healthcare system. Instead, we've had a patchwork of regulations, government programs, quasi-markets, and partial socialism. But we can imagine what a healthy system would look like. To remedy the problems in our healthcare system, we have to isolate them. Let's start with state coverage mandates. Coverage mandates are items in your plan the state government forces you to pay for. Mandates limit your options and drive up premiums. North Carolina, for example, has 47 mandates, including chiropractic, drug and alcohol abuse treatment, and pastoral counseling. By contrast, Idaho has only 15. North Carolina's average annual premium costs $3,080, while Idaho's is only $2,006. Since some mandates are more expensive than others, a simple counting of mandates doesn't explain everything. But when you consider both the number and the total cost of a given mandate, you'll find a direct correlation between mandated coverage items and the cost of the average health plan. In short, mandates drive up costs, which makes insurance less affordable. And besides, why should the government force you to buy these items? The second pathology of healthcare is the unequal tax treatment of different types of health insurance. It sounds boring, but this is important. Section 106 of the tax code says the value of health benefits is not counted as part of the taxable income of employees. That is, health insurance is excluded from their taxable income as long as the employer writes the check for it. It's been this way since World War II, a time when the government froze wages, but companies wanted a way to offer non-wage benefits to prospective employees. However, says the Galen Institute's Grace Marie Turner, workers may receive this tax-favored benefit only if health coverage is provided through an employer. Because it is excluded from their taxable income, the value of the health coverage, the tax benefit, and the costs and foregone cash wages are largely invisible to workers. All of which is to say, if you're lucky enough to get health insurance through your employer, once you have it, you don't think about it. But what about the distortions this causes? First, job-based insurance undermines cost consciousness by hiding the true costs of both insurance and medical care from employees. Then, because the full cost of health insurance is not entirely visible to employees, it artificially supports increased demand for covered medical services and more expensive insurance. As a result, wasteful, inefficient healthcare delivery is subsidized at the expense of more efficient care and coverage. Next, cash wages and salaries are suppressed as health insurance costs rise. Most employees with job-based insurance have little choice about their health insurance provider. Most jobs only offer one provider. But since it's subsidized, why would you shop around? The tax benefits are therefore skewed to favor higher-income individuals and those who demand the most expensive health coverage and treatments. So the tax system subsidizes the wealthy and gainfully employed. That's not how to deal with the problem of the uninsured. Millions of Americans who are unemployed or whose employers do not offer health insurance are discriminated against because they receive much less assistance, if any at all, when they purchase health insurance. In short, if you're employed by a big company, you're probably getting subsidized health care. If you're not, say you're a waiter, or self-employed, or even unemployed, you get unfavorable tax treatment. A large percentage of the unemployed population falls into one of these categories. No matter how you slice it, the tax code drives up healthcare premiums for everyone. Now, consider the third major pathology: overconsumption due to our third-party payer system. Overconsumption, you may be wondering. How is this a problem? Well, think about the last time you went to the doctor's office. And let's say she did a blood test. Can you say how much it cost? If your answer is $15, your answer is incomplete. We're looking for the full cost. How much did the doctor charge your insurance company? You probably don't know. Most people don't care either. But that extra cost you don't ever hear about, everyone pays for, in the form of higher insurance premiums. And that blood test, how much did it cost? It might have been $300. Someone has to pay for that. Here's how it works. Imagine you're at a big dinner party at a restaurant. Everyone at the party decides to split the costs of the dinner evenly. Do you order the chicken or the surf and turf? Well, since the costs are shared evenly, you reason that you might as well get the most expensive item. Otherwise, others will, and you'll be subsidizing their more expensive meal. But what happens to the total price when everyone thinks that way? That's right, the price goes up. Likewise, if you're only paying $15 for any prescription you may be getting, or any doctor visit you might have, why not choose the most expensive option, or let the care provider choose it for you? For example, heartburn sufferers can pay a copay for a prescription of Nexium, or they can get Prilosec OTC, or Zantac, which would be even cheaper. If you're only paying $15, why not go for the most expensive stuff? In reality, Nexium could be more than $100 per prescription. Or say you got a case of the sniffles. Is there any reason for you to go to a licensed medical doctor? Other than the fact that the visit costs only $15, probably not. For your car, it would be the equivalent of charging oil changes to Geico. If you could do that, imagine what they'd charge you for an oil filter. The same kinds of problems exist for CT scans and other more expensive products. With a third-party payer system, people are simply shielded from the full costs of care. Indeed, most people don't even know what the prices are. How can anyone ever be cost-conscious if they don't know how much things cost? When you add up all of the overconsumption that results from our third-party payer insurance system, costs go up. Way up. Let's turn now to Medicaid. Medicaid was originally intended for the very poor, but now many politicians want to extend Medicaid benefits to people who aren't poor, especially children. The problems with this approach are manifold. First, Medicaid is a massive unfunded liability that threatens to break the bank sometime in the future. This is not just a problem of demographics, but of a perverse system in which, for every $1 a state like North Carolina pays in Medicaid, the state gets $3 from the federal government. This sends a signal to politicians: find more ways to spend more money on Medicaid. Why do you think states are going after middle-class children? But this doesn't make sense given that not nearly all of the poorest people are enrolled. Shouldn't Medicaid priorities go to the poor? Another problem with expanding Medicaid into the middle class is that it causes crowd out. That means people who could afford insurance opt instead for government health care. But this shifts costs onto a system that is already straining state and federal budgets. What's worse? Since people have to qualify for Medicaid based on income, they will be less inclined to get a better job if they think they will lose the health benefit. They become dependent on Medicaid and locked in at one level of wages. This is known as a wage trap. If you get a raise, you lose your overall benefit. But isn't upward mobility a good thing? Medicaid discourages upward mobility. Let's return to the idea of expanding children's Medicaid, or S-CHIP. This might seem on its face to be a good thing. Who doesn't want children to have health insurance? The trouble with expanding children's Medicaid, however, is that it helps drive the death spiral. Consider a risk pool in health insurance. Risk pools work because people who are lower risk, younger, healthier people, help offset the costs of those who are higher risk, older, sicker people. As people get older, more young people offset their growing risks. But when you take younger, healthier people out of the private risk pool, who is left in the risk pool? Older, sicker people. That means, for them, costs go up. Indeed, as premiums go up, younger adults starting their careers who might otherwise get insurance decide it's too expensive. But this represents a further strain on the risk pool. Older, sicker people can't do without insurance, so they have to pay a lot more. Young invincibles who go without insurance invariably get sick or hurt anyway and strain the system in other ways. The whole process is a vicious cycle known as the death spiral, and the expansion of Medicaid contributes to that cycle.